Hello everyone, welcome to my channel Ravi Study Features. So in this series of pharmacology, we are moving further and taking topic which is antipsychotic drugs. And also the next topic is anti-epileptic drugs. So what is antipsychotic drugs and which condition we are using the antipsychotics? So let's brief about that. What is the antipsychotic? So any severe mental illness that cause loss of touch, motor control, function, sensory output, hallucination, delusion, thought perception and behavior. Sensory output not hallucination, delusion and extra thought, or like bipolar kind of disorder and mental illness severe. So that kind of severe illness have to becomes under antipsychotic. So what is the treatment, like which kind of medication we have to like used? So antipsychotic drugs, it mainly treat psychosis related conditions and symptoms. Psychosis, it means hallucination, delusion and mental illness. So the condition do antipsychotic treat like schizophrenia, bipolar disorder, mania, delusions, disorders, severe agitation. So these are some symptoms for treatment treatment or drugs, pharmacological treatment we have to be implement of these patient. So there is a generation of the drugs for implementing or like a condition based drug. So the types is the first generation antipsychotics. So the conditions are these block the way your brain uses several neurotransmitter, especially dopamine, also acetylcholine and histamine. So if any kind of these hormones like dopamine, acetylcholine and histamine. So what kind of function of dopamine, acetylcholine and histamines we have already covered in the previous video. So the like brief about that: dopamine like relax mind, or like acetylcholine happy hormone, sleep cycle, or like different kind of function of the body, intestinal activity. Histamine is to be relaxed mind, mood swings. So all of these control by these hormones. So if any kind of like deformity occur, so the release of these hormone and neurotransmitter is continuously and reuptake inhibitor is not perform or work accurately. So on that time we are taking the first generation antipsychotic drugs. The drugs are chlorpromazine and lexapine pimozide. So these are medication to help to treat of these specifically dopamine, acetylcholine and histamine kind of hormones, to stop them and reuptake them. Second generation antipsychotics. So basically these medication block receptors like serotonin, dopamine, and they activate other serotonin and dopamine receptors. So basically what is that? If the dopamine and serotonin release continuously and reuptake is also with stopped, and there is cause another symptoms like schizophrenia or like bipolar disorder, and other cause symptoms like migraine or headache, or also Alzheimer's disease, and also psychosis related any other condition, other symptoms. So on that time there is severity have to be ultimatum mode. So in this ultimatum we have to be take the medication is to be acinapine and clozapine. Make sure you have to be consult to the doctor before taking these medication. Next is to be what is the potential benefits of the first and second generation of the antipsychotic drugs. So the potential benefits of antipsychotics can also make other type of mental health treatment like psychotherapy. So if patient is suffering from any kind of psychosis related problem, so also these drugs are helpful to relax their mind and control the mood swings like psychosis related therapy. So next is to be what is the side effect if you are taking too much antipsychotics drugs. So the abnormal movement you have to be shown the patient if continuously taking the antipsychotic drug like pimozide and loxapine, and also dizziness, constipation related issue, sedation like hallucination, and like too much like a sleeping feeling, dry mouth, jaundice, and increased cholesterol and increased blood pressure. So why? Because it also reached out the circulatory system and enhance or boost their blood pressure, because it helped to like narrowing the blood. So it will be increase the blood pressure over there, and increase of the blood pressure it will be reached out targeted organ, so it will be slow down, or if it will be slow down, so it will be shows the jaundice related problem, because there is a major fighting like WBCs organelles, it will be blocked over there, so it will be blocked. So jaundice related symptoms you have to show on the patient, and yellowish eyes and yellowish bodies and keratins you have to be shown there. So the most common prescribed medications are haloperidol and perfenazine. So these two medication have to be consult the pharmacies and the doctors. So make sure you have to be consult before the doctor if you are taking these medication. So that is the antipsychotic drug. Thank you.